Friends of the media, thank you for coming to the press conference today. Sorry that we are late for about 15 minutes. In a moment, the Chief Executive and other officials will speak, and then they will take questions from you. First of all, can I invite the Chief Executive to say a few words? Thank you. Friends of the media, members of the public. Now, I am chairing this steering committee command center. We've had 4 meetings in the past week. We've announced a series of measures for prevention and control of the disease. Yesterday, the Chief Secretary for Administration met with the media to give you an update on the supply of face masks. Today, at the press conference, we will report on several issues. First of all, the World Health Organization announced last night or early morning Hong Kong time that they made a statement on the latest update on this novel coronavirus. Now, perhaps I will highlight on parts of the statement relevant to Hong Kong. And then secondly, we're going to report to you on the progress of implementation on the announced measures. And thirdly, we will report on our further prevention and control actions. First of all, on the World Health Organization statement, they have taken on board the recommendations of the emergency meeting. First of all, the WHO welcomed the effort made by the People's Republic of China on to control and prevent the disease, and it is a matter of international health. This constitutes a public health emergency of international concern, and if I may point out in the statement, they say that they have decisive and resolute measures should be taken. Then they will prevent the spread and control the disease. So as long as we take such measures and then we track all those involved and so on, and take all necessary measures, it will help to stop the spread of the issues. But then there are, of course, constant changes in relation to the epidemic, and then there is a need to make corresponding adjustments to the measures. As you might recall, in the past week, we've been closely monitoring the latest issue and in making the necessary adjustments. This week, we have announced 8 measures in response, and then we have looked at each of these measures and then we try to compare it with what is said in the statement and find that most of the measures match those suggested by WHO. Of course, there are certain areas where we could do even better. Now, in fact, we have adopted some of the measures before the WHO made such suggestions. For example, early detection, isolation, management of cases, tracking, and so on. We will have regard to the recommendations made by the WHO, and it will take concrete measures, including that at international border control there should be exit screening. This is and then we should reduce social contact. We must give better protection to healthcare personnel, and then there must be some better communication. The SAR government will follow closely the suggestions made by the WHO, and then in light of developments, we will make necessary adjustments to measures announced. Now, on the second part, that is the measures that we have taken, I would like to report on the implementation. Now, usually at 4:30, the Hospital Authority and the Department of Health, that is in particular the Center for Health Protection, they would host a press conference at 4:30 to give you the latest update. But of course, this press conference has been replaced by this one today. As at 9 a.m., the Center for Health Protection, they recorded 12 confirmed cases of novel coronavirus infection. And then out of those, 11 cases are imported or related to imported cases. One case is still under investigation. So for that one case under investigation, of course, it will be of great significance. And then 5 of those cases are Hong Kong residents, 7 are mainland residents. As at noon yesterday, 680 cases met the reporting criteria. 478 of those cases have been ruled out to have nothing to do with the coronavirus. As for another 191 cases under observation, they are still in hospital undergoing checks. And then of these cases, 550 involve Hong Kong residents, 130 cases involve non-Hong Kong residents. I understand that tomorrow the Hospital Authority will be able to carry out the rapid test at the 7 clusters of hospitals. There is no need for them to send all the samples to the Department of Health Center for testing. So with this new testing arrangement, it will help us to speed up the test, and then we could get the results sooner, and then that will help to lessen the burden on healthcare staff. On the 28th of January, we announced a number of measures. They could be grouped into several categories. First type, they would substantially reduce the population mobility between the mainland and Hong Kong. Now, as at yesterday, well, because there are various cross-boundary traffic services, and they've been reduced, and it started yesterday. So yesterday was the 30th of January, and the incubation period is 14 days, so 16 days before yesterday, for all arrivals from the mainland at all the boundary crossing points except the airport. Now, compared to the 14 days ago, the number has dropped by 91%. Yesterday, number of arrivals, mainland residents only accounted for 9.7% of all the arrivals. In other words, most people arriving yesterday were Hong Kong residents returning to Hong Kong. And then we'll continue to implement all the stringent measures. We will manage our boundary crossing points properly. So we believe there will be further reduction in the flow of people between the two places. But we will keep in close liaison with the mainland and see if there is need to consolidate and review the strength of our measures in managing the borders. As WHO said, there is a constant evolution of the disease, and so we will continue to monitor constantly the developments, and on reduction of people flow between Hong Kong and the mainland, we will see what more needs to be done. And here we would like to make an appeal to the public. Unless it's absolutely necessary, please avoid going to places where there's been an outbreak, and of course that includes the mainland. Now, because for Hong Kong residents leaving Hong Kong to go to mainland, of course they will have to come back eventually. Now, during this period, we've seen a substantial reduction of the number of people leaving Hong Kong for the mainland, but the number is still significant. For example, yesterday, on the 30th of January, there were still 37,000 Hong Kong residents leaving these boundary control points. Most of them were heading for the mainland. So that means when they come back, they will bring with them the risks of infection. For the second type of measures announced last week, that involves reducing the mobility within Hong Kong and social contact. That's the social distancing recommendation of the WHO. Now, we following the latest development in of the outbreak, and then we know that there will be a tight supply of protection equipment, including masks. So that's why at this point in time, it is even more important to minimize social contact, because if you stay home and you don't go out, you don't need to wear a mask. That's why earlier we announced that for all schools, primary schools, secondary schools, kindergartens, and special schools, originally they would resume class on the 17th of February, but at that time we already cautioned that we will have to review the date having regard to the latest developments. Today, we announced that the soonest date of resumption of class would be the 2nd of March, but of course we will have to review it again. Of course, some say that we should delay class resumption indefinitely, but at least we should give a clear indication to schools that is from now until the until the 1st of March, there is no need to go back to school. On the 2nd of March, where this class could resume, we will have to see, as we monitor the developments, the supply of protection equipment and other possible considerations. We will then make a decision and make an announcement on class suspension, resumption, or on public examination arrangements. The Education Bureau will keep in close touch with school sectors. Now, the Secretary is not here because he still needs to discuss various issues. Next week, the Secretary for Education will meet with the media to explain all the details to the public on our assessment and decision to resume class. As I said, the vectors include the developments of the epidemic, the supply of protection equipment, and so on. So there must be adequate conditions before, that is, we must make sure it's safe before we will resume class, and we will make early announcement. So in other words, we won't announce today that class will resume tomorrow. So we will give school plenty of time to make preparations. But I must stress that with this class suspension arrangement, we hope that students will stay at home instead of moving around in the community. Otherwise, it will not achieve our objective of minimizing social contact. On work arrangement, the SL government is a major employer. We must, of course, deal with the issue. Earlier on, the government announced the special work arrangement for certain departments, that is after the public holidays of the Chinese New Year, that is starting from the 29th of January, unless there are individuals who need to provide essential or emergency service. Other government employees do not need to go back to the office to work. In other words, they could work from home. And the announcement applied to up till this Saturday, that is this Sunday, that's the 2nd of February. In other words, if everything is safe, then that means on the 3rd of February, everything will resume to normal operation. But then we now see that the situation remains dire, and it may remain for some time. So, at the same time, we cannot just keep to essential and emergency services. There are other services needed by the public. So starting from the 3rd of February, the arrangement in general is that government departments may extend the work-from-home arrangement that I mentioned just now. But essential and emergency services must be provided. And then today, on top of that, we are announcing that basic and limited services must also be provided. So heads of departments will have regard to their own situation, and then make an announcement as soon as possible. I've required them to make an announcement within the next day or two, especially those departments that are in constant contact with the public. So they need to announce early what the arrangement is, what services are considered essential or basic, and what services could be provided in a limited scale. And then for other employees, they could continue to work from home. This arrangement will be in place until next Sunday, that is the 9th of February, because we need to review the arrangement on a weekly basis. For schools, it's different. We need to give more time to schools because we're talking about a large number of students. And also, we need to give enough certainty to schools so they know that they won't be able to resume class for almost a month. But as for full resumption of government services, we will review the arrangement on a weekly basis. And I've also asked the Secretary for Civil Service to consider the views of departments and the latest developments. And also to take into account the arrangements that I just mentioned, that is, there's need to provide basic and limited services. We'll see what staff response is, and then the Secretary will report to the steering committee, command center, and then we'll make suitable recommendations. Here, I would like to appeal to non-government organizations and the private sector to also have regard to this policy objectives. We are still in a critical phase, so that we should reduce social contact. We should reduce the need for commuting to work, and therefore reduce the chance of infection. And we also have to have regard to the supply of protection gear. So in summary, that means we hope our employers will be flexible with the work arrangement. Now, third types of measures, that is to strengthen medical surveillance and reduce the risk of transmission. Here, we talk about several types of people. First, Hong Kong residents coming back from Hubei, Hong Kong people coming from mainland, and also Hubei people in Hong Kong. Here, we would like to appeal to the Hong Kong residents again to come back to the mainland from the mainland as soon as possible. As for residents who have come back to Hong Kong or who are in Hong Kong, they should not go to places with an outbreak. So I mentioned some figures, and there are just now there are still over 37,000 people going from Hong Kong to mainland, and that will of course add to the risk of transmission. Now, apart for all Hong Kong residents coming back from mainland, except for those coming from Hubei, within 14 days they should stay at home as far as possible. If there is need for them to go out, then within the 14 days after they're back from to Hong Kong, they should wear a face mask. As for people, Hong Kong residents who were in Hubei province, when they come back to Hong Kong, they should liaise with the Department of Health, and then they will do an assessment. If there's a need, they will be sent to the relevant quarantine center for examination. So this is a strengthened measures. That is even before they show any symptoms, or before they have or even if they don't have a temperature, they must go into the special quarantine center for examination. So this applies to Hong Kong people who were in Hubei province in the last 14 days and who have now come back to Hong Kong. Now, of course, in the second half of January, the city was closed off, so that we believe there wouldn't be too many of such cases. And in a moment, Dr. Constance Chen will tell you that at the boundary crossing point, several such Hong Kong residents were detected. Now, for visitors coming from Hubei, now usually when visitors come to Hong Kong, they have 7 days. But then starting from the 27th of January, there's a restriction on Hubei residents and those who've been in Hubei in the past 14 days. So there's the restriction on these people coming to Hong Kong, so that number should be coming down, and there shouldn't be too many such people. So in a moment again, there will be a report on the number of such cases. We're not going to, we're going to keep up our efforts. Starting from the 29th of January, the Immigration Department is checking hotels and guest houses in Hong Kong to find the Hubei visitors who are still in Hong Kong. Their contact information has been noted, and then there will be health advice to them. As at today at 1 p.m., the Immigration Department has checked 355 hotels and guest houses. 48 Hubei visitors were found. 15 of them left Hong Kong on their own. The Department of Health will arrange for other visitors to stay in a quarantine center. As for visitors without symptoms, arrangements will be made for them to leave Hong Kong as soon as possible. Again, so this is another upgraded measure. Now, for Hong Kong residents coming back from Hubei province or for Hubei visitors still in Hong Kong, if these visitors do not leave on their own, we will send them to the quarantine center. That means there will be a heavy demand for the quarantine center services. We have 3 centers, the 2 holiday camps, Lady Macleho's camp and also the Lei Yue Mun camp, and then the Pak Tam Chung camp of Po Leung Kok. So they are able to provide 90 units. So we are making preparations for more quarantine facilities. Now, the press, of course, concerned about the situation of Hong Kong residents in Hubei in a moment. The Secretary for Constitution and Mainland Affairs will give you an update. Well, as I mentioned last time, we had great difficulties finding quarantine facilities in these places. So if we don't have enough quarantine facilities, we cannot rule out the possibility of home isolation. So about requiring people to go into home isolation, we are making preparations. We are considering the use of electronic tracking armband or other technology for tracking purpose. The science park facilities have been making, looking into that. Hopefully by next week we will have this electronic tracking bracelets and GPS units. So these 200 units could then be used by those that require home isolation. On strengthened surveillance. Now, firstly, there are 2 areas. One, in accordance with WHO, we have to pay more attention to international travel. Now, we used to focus more on surveillance on those coming on arrivals, but now WHO suggests we should also step up surveillance on departures. So starting from tomorrow, therefore, at the airport and the boundary crossing points, we will be screening departing passengers. There will be temperature checks. If we find that any departing visitor has a temperature, he or she will not be allowed to board a plane. And then also for the land crossing, starting from tomorrow at Lowu and Shenzhen Bay, BCP, there will be health declarations requirements. Now at these points, there's already temperature check, but we're going to step up the measure and require health declaration. Now I will invite Professor Sylvia Chan to tell you more, to give you an update on the latest situation.
Thank you, Chief Executive and friends of media. Just now, the CE said that we have heard the WHO today made a declaration about the 2019 novel coronavirus. We have looked at the declaration, and of course, we would tie in and also learn, take experience from the declaration and adopt the measures. As CE just said, most of the suggestions have been implemented already by us, and we will fully tie in with the suggestions they made. We will continue to adopt those stringent measures, including early detection and also isolation treatments for those cluster of diseases. Of course, we would trace the close contacts, and also we would implement measures to minimize social contacts. This will minimize the risk of a community outbreak, and also by doing so, we will be able to stop transmission of the disease. We have imported cases in Hong Kong. The Food and Environmental Hygiene departments and also the Food and Health Bureau have been responding to the the aspects, including enhancing risk communication. We are holding press conference daily, and we have stepped up surveillance and tracing. Port health measures are also very important. Just now, the CE mentioned the hospital authority has established rapid test and announcement system. And also we have isolation treatment measures in public health hospitals. We have been liaising with the WHO and also the mainland authorities. These are all ongoing. For our next step, there are many works to do, especially according to WHO's suggestions. We are going to address social context of different levels of risk. We have issued advices and appeals. Of course, firstly, we urge you to stay at home. If you have to go out, you should put on a mask and you should avoid crowded places. And we urge the employers to adopt a special arrangement for work. And also, we will partially close our facilities. And also, I would like to mention that in terms of early detection, early isolation, and early tracing of close contacts, about these works, we have seen improvements. CE just mentioned a few measures about adopted by the Departments of Health concerning health advices to Hong Kong people returning from mainland, and also quarantine camps measures and also the checking measures. Dr. Constance Chan is going to tell us about the latest figures. About the public hospitals, on the 22nd of January, we have activated the emergency response level. Hospital authority has already adopted the relevant measures and stepped up their surveillance measures, including isolation beds. We have 700 isolation beds. The utilization rate is about 40% as of now. We will keep close monitoring of the utilization of isolation bed and provide these isolation beds. Medical staffs are at the front line of the battle against the disease, so the HKSAR government attach huge importance to the need of medical staffs. The hospital authority has done a lot of work. After activating emergency response level and also enhanced measures to prevent transmission, the hospital authority recorded a surge in demand of masks. So the government is assigning priority to surgical masks. Surgical masks and protective gear will be provided to the frontline medical staffs. Yesterday, the Chief Secretary has announced multi-pronged approach by the government to steady provision of surgical masks. We will attach top priority to our medical staffs with the intention to protect the health of our medical staffs. We understand that medical staff working in high-risk environments will be very anxious that the health of their family might be affected. So short-term residence might be needed. The HA has been securing temporary residence for our staffs, and also we are seeking residents outside of the hospitals. I was told by the HA that special allowances has been given to medical staffs working in the high-risk environments for them to rent hotel rooms. I urge patients that they should honestly provide all the information necessary for medical staffs to give them an accurate consultation, including their medical history and also their travel history. And they should fully cooperate with our medical staffs. This is for their own sake. And also, it is very important. It is of utmost importance in terms of protecting medical staff's health. With the disease getting more serious, it is a very critical time in battling the disease in Hong Kong. The government is keeping a close eye on the evolution of the disease, and adjustments are going to be made for the measures in order to protect our citizens' health. I appeal to our medical staffs to remain steadfast in their position and to tide over this challenge. Of course, the HA will continue to listen to the needs and the appeals from the medical staffs. And once again, I would like to give my thanks to our frontline medical staffs. I will defer to Dr. Constance Chan for the figures.
Now, I would like to report on joint operations with the Immigration Department. That's at 3:30 p.m. today. Based on information provided by the Immigration Department, we have made attempts to reach 28 visitors coming from Hubei or Wuhan. Now, out of the 28, some have left Hong Kong, and for some we've checked with them, they said they were not in Hubei province within the past 14 days. Now, if someone's been to Hubei province within 14 days, then he or she must go into our quarantine center. For this particular visitor, the visitors left Hong Kong. Nothing else from Dr. Chen then? Mr. Patrick Nip, what about the Hong Kong residents in Hubei province? Yes, good afternoon. For Hong Kong residents in Hubei province, the SL government received about 600 cases involving 1,300 Hong Kong people in 30 cities in Hubei province. We continue to receive new reports of new cases, so the number may still go up. For the Wuhan office of Hong Kong SAR and so on, we've been trying to assist the Hong Kong residents. The government pays is very much concerned about the situation of Hong Kong residents there. From what we understand from those who've asked for help, they're in good condition. And then we have a health hotline for Hong Kong residents with need. They could directly contact the Department of Health for further advice. And the Wuhan office has also provided online contact methods in Wuhan, so if necessary, Hong Kong residents could make use of the online inquiry service. And then we are in close liaison with relevant province and cities to provide assistance as far as possible. For example, some Hong Kong residents may need replenishment of certain medication, then we will try to provide assistance as far as possible. And WHO stressed earlier that it is important to reduce population mobility in centers of outbreaks. So at this stage, they do not recommend any evacuation exercise. So the SL government has fully assessed the safety and practicality of arranging for Hong Kong residents to come back to Hong Kong. Now, we have considered several points. One, Hong Kong residents are spread out in different cities in the Hubei province. As you know, in Hubei province, there's no more transportation arrangements. So that means we have to first arrange for them to gather at one point to take them back to Hong Kong. Now, some of these cities are in remote areas. The journey time may be some 10 hours before people get to Wuhan. That's the first point. Second point, there are quite a number of Hong Kong residents in Hubei province. So in Therefore, we need to make sure there is no contamination as they travel together. We need to take necessary measures. Therefore, third point. Now, when these people come back to Hong Kong, since they are coming back from Hubei province, just now the Director of Health already mentioned there is need for them to go into isolation for 14 days. That's why we need to make proper quarantine arrangement to reduce the risk of infection and community outbreak. So we need to arrange for these people to go to a quarantine center for isolation for 14 days. Just now you heard about the latest number of quarantine centers we have. So again, therefore with this group of Hong Kong residents, we have to consider the quarantine arrangement further. So based on these three considerations, what we would do is that our colleagues at the Wuhan office will continue to stay in close touch with Hong Kong residents and provide them with timely support. And then we will also keep in close liaison with the relevant ministries and mainland departments, and we will explore the practicality of sending them back to Hong Kong. So that's the latest situation. Any questions, please? TVB. Colleague, can you please move your camera a bit? Okay, now the floor is open to questions. First, please identify yourself and your news organization before you ask questions. Sorry, I can't see those reporters at the back. Okay, now the reporter here at the front. I'm from Hong Kong 01 Pang Chak Wai. 3 questions, Chief Executive. First question about border closure. There is increasing demand for full border closure. Many believe this is the most effective way to stop the risk of community outbreak. But having heard you all this time, you never mentioned any actions on full border closure. So have you heard the views of the people? Are you not going to do that? Are you not going to consider closing more boundary control points or full closure altogether? And on evacuation, just now the Secretary for Constitution and Mainland Affairs just mentioned the considerations that we know different countries are arranging for charter flights to evacuate their nationals. So you have not done anything so far. So is it that even after you've considered all these factors, you will not arrange for charter flights to take Hong Kong people back to Hong Kong? Third question is on masks. Now, as many people worry that there won't be an adequate supply of masks, so there's a panic. So they started queuing in the cold in the early morning for masks. So what do you think when you see scenes like that, Chief Executive? Thank you. I'll take the 3 questions, and then Mr. Nip will explain further the situation about Hong Kong people in Hubei province. Now, at the last press conference, many friends of the media asked the question. Now, there is this saying about what exactly is meant by a full border closure. So we shouldn't just be shouting slogans. By a full border closure, that means we close all the boundary control zones at the boundary control points. And now, before we closed some of the BCPs, we had over a dozen BCPs. So that's for population mobility between Hong Kong and the mainland and other places as well. So the suggestion for full border closure, what the general understanding is that means we close all the control points altogether. Now, I understand. I noticed that certain countries may take such a step later on, although that is not in line with the latest recommendation of the WHO. Now, WHO, as I mentioned, has decided to make this an incident of public health with international concern, but then they also make clear that they don't see the need for complete control of movement. So the WHO has come up with these recommendations, which are science-based and with the objective of controlling and prevent the spread of the disease. So given the current situation we see, it's not possible to close the border. I just gave you some figures. You see there are still a large number of Hong Kong people going in and out of the mainland. In fact, there are far more Hong Kong people moving between Hong Kong and the mainland than mainlanders. Previously, I reported Hong Kong people accounted for about 75% of the movements between the people flow between Hong Kong and the mainland, but now they account for some 90% because there is now a single digit in terms of percentage of mainland visitors coming to Hong Kong on plane. So is that what they mean by closing the control points? That is, we close off everything. But, you know, as you hear more views, you see it's not exactly what they meant by full border closure. It means completely stopping mainland visitors coming to Hong Kong. In other words, we will ban certain types of people from coming into Hong Kong. Again, I'm afraid that is not in line with the statement of the WHO yesterday. Actually, it's in conflict with that. Now, according to the principle free of the relevant international convention, that we must not encourage any discrimination. So therefore, we have to exercise caution here. Now, what we are doing is that we have stringent control of boundary control points, so as to reduce people flow between the two places. I have given you some figures already just now, and I believe you see a continuous decrease in those figures. It's because it's only yesterday that we closed 6 boundary control points and substantially reduced the number of flights and ferry services and land transportation services. We believe these are the more appropriate measures to take, and these measures are in line with the requirements of the WHO on various countries. Now, of course, Hong Kong is a special administrative region, but we always attach importance to recommendations made by the WHO and their member states. Now, on controlling the border and how much we should do, as I said, we will closely monitor the situation, and we will keep in close liaison with the mainland, and I will explore whether we should take even more stringent measures in controlling the border. Now, on suggestions to fully close the border, especially there's such a suggestion from hospital authorities, some hospital authority staff. I fully appreciate their concern about being infected, and at the same time we want to do their job as healthcare professionals. But then if you look at all the figures, you see that for most of the infection cases, they involve Hong Kong people. So what we need to do is to do our very best to protect our healthcare staff. For example, there are certain services provided by the hospital authority. We could reduce some of those services. Dr. Koh is here. He could tell you more if you want later. And then we must provide sufficient supplies to healthcare staff. And also, when healthcare staff go off work, we need to make a special accommodation arrangement for them, for instance. Now, the host community must be involved in preventing the spread of disease, but we must there must be accommodation, mutual understanding. We must not target a particular group of people. On the supply of masks, while there is a tight supply around the world, we've been trying to procure masks from all around the world. We've approached many suppliers, and it's true we've experienced certain difficulties, but we're taking a multi-pronged approach. Hopefully then we could tell the public when we may have masks, because as you said, there will be supply coming in. There is no need for panic or undue anxiety. There's no need to try to snatch any masks you could. But have also taken measures to reduce social contact. For instance, some 900,000 students don't need to go to work, and they will substantially reduce the demand for masks. And then the healthcare experts, including WHO, have issued a directive on when there's need to wear a mask, and then on other occasions there are other measures to be taken to protect oneself, and so on. Perhaps Dr. Constance Chen could tell you a bit more. We are going to establish communication with the public so we could disseminate such messages. For those who do need the protective gear, such as masks and protective clothing, we'll make sure these groups will receive the supply they need. And so, as Professor Sophia Chen pointed out, with tight supply, we must first give priority to healthcare staff, make sure they have adequate supply. And then for personnel who needs to provide essential and emergency services, we also need to make sure that they have the necessary supply. As for the general public, we need to make sure there is the supply in the market. So, yes, there are private retailers who make a procurement, but if they encounter any difficulties in the process, we will more than prepared to help them to address those problems. And as the Chief Secretary pointed out yesterday, with our intervention, we're able to make sure that many orders placed by private sector retailers will reach Hong Kong. So that means there will be boosted supply. Though I dare not say that that we'll have enough supply, so there is no more shortage. Now, in recent days, at healthcare units and at the community level, we have seen a huge surge in the usage of masks. So therefore, we could expect a tight supply of masks for some time to come.
About Hong Kong residents in Wuhan and Hubei, I would like to talk about the arrangement for them. We are very concerned about their situation, and our colleagues in Wuhan office and immigration offices in Hong Kong have been actively contacting them and providing them with support. We will continue to follow up on the cases. Secondly, we are considering what the most appropriate arrangement should be. We should look at it from the public health perspective. The WHO emphasizes that we should minimize cross-boundary mobility movements in infected areas. Many visitors from Hong Kong have been to Hubei for visiting their relatives. So we need to assess the risk of moving them, whether it is suitable to move them. And we have prepared suitable plans. After all, we need to seek support from the local ministries and departments locally, because the local transport system is in a halt. The number has exceeded 1,000, so we need to consider the 14 days quarantine issue. We need to secure a place to quarantine those who return from Hubei. We have 3 quarantine centers providing 90 units. We have been actively following all these up. As of now, we are making all necessary preparation and assess the situation as it is. And when time is ripe, we will take action with the assistance from the local authorities. The one in the last row, I am from TMHK, Mr. Zhang. I would like to ask a few questions. How many Hong Kong people stranded in Wuhan or Hubei wish to come back to Hong Kong? What is the time frame that you will provide assistance to them, and we will arrange a flight to take them back? And there have been 2 confirmed cases in Hong Kong yesterday. One of them has concealed his symptoms. So is there is there a risk of outbreak in public health in public hospitals? And will you trace those which have contacts with the patients and quarantine them? And you said you are very concerned about provision of masks, but you have been very vague. You talk about working with the retailers, but what is the number of masks in inventory that you have, and how many masks can you provide to the citizens in case of an emergency? About the 600 odd cases of requests, those have been to Hubei to visit relatives or for traveling, and they have seek assistance from us and they wish to return to Hong Kong. We will continue to liaise with them and to follow up on the situations. If they need any medicines, we will assist them. And we need to consider the relative arrangement as well in terms of how we are going to bring them back to Hong Kong and when. We need to discuss the arrangement with the local authorities and to acquire their support. And also we have to think about the quarantine arrangement after they are back to Hong Kong. We will proactively monitor the progress and follow up on the cases. Dr. Constance Chen, please. About the 2 confirmed cases yesterday. For the first case, we are still getting information from the couple. The investigation is still ongoing. And for the 12th case, the Hong Kong residents has been to Shunda and Macau. We are communicating with the Macau authority to get an understanding of where and what the patients has been doing in Macau. And for these investigation, we need to know where the patients has been in the past 14 days, so the investigation would not be concluded in 1 or 2 days. I will invite Mr. Yao to talk about the mask issue. Yesterday, when the Chief Secretary met with the press, he has gone into it in detail. I will repeat what he said. There are 3 major aspects. As Professor Sophia Chen said, during this period, there has been a surge in demand for these protective gears internally in the hospitals. So the first task of the government departments, the government has started up procuring of protective gears. Besides the original suppliers, the government's department has extended its procurement network globally. And also flexible policy has been adopted in procurement and ordering. Secondly, we are providing assistance to enterprises. When we consulted the trade, the suppliers, we know that the suppliers are usually from the mainland, but there has been a shortage in mainland, and some suppliers are manufacturing these masks far away from Hong Kong. So we need to facilitate custom clearance and logistics for them. We have been doing that, and so directly and indirectly we have facilitated our procurement and also procurements by the private sectors. When there is a delay in delivery, we would contact the mainland customs for inquiries about the consignments, so as to facilitate timely delivery of the consignments into Hong Kong. And we have made it clear to the trade, of course, it is all very well if they procure us themselves. If they encounter any issues, we would help them, but we will not, our efforts should not overlap. Thirdly, with the surge in the demand of masks, local production is a new direction to be considered. To produce these items, it does not require high technology know-how, but we need plants. And there have been discussions about whether we can install production line in Hong Kong, like in industrial estates. If we have production lines locally, we can steady the supply of masks in the mid to long term. Some enterprises with goodwill, they have been procuring masks themselves, and they have been donating the masks they have, and we are delivering their donated masks to those who need them. We don't have a large stockpile at hand to deliver masks locally, but we are trying to facilitate delivery to Hong Kong and also increased procurement in order to fulfill the market's demands.
Thank you, Richard from RTHK. Mrs. Lam, I'm sure you know that there's a vote tomorrow from some employee hospital unions talking about going on strike possibly if you didn't close the border. Sounds like you're not willing to do that. Are you willing to take that risk of thousands of employees going on strike as a result of sort of this emergency situation? Secondly, with the new sort of surveillance measures for Hubei visitors, would these measures have stopped visitors, for example, from jumping from hospital to hospital without authorities being able to do anything to force them to seek medical care? And thirdly, on face masks, I'm sure, Mr. Yeah, you've already sort of covered this, but is this something where the government could be taking a more centralized role in terms of distribution and also controlling prices so that we don't see sort of price gouging and long lines around the neighborhoods waiting for face masks?
Well, thank you for the three questions. I will answer the first question and then invite the Director of Health to talk about the medical surveillance and Mr. Yao to comment on the question of pricing and distribution of surgical masks. Well, I sincerely hope and appeal to our health staff in the hospital authority to consider very seriously any plan to have a strike. Because at the end of the day, those who suffer will be the patients as well as Hong Kong's healthcare system. I said repeatedly that we treasure the contribution of our health staff throughout the years. It's not just about this particular virus incident. I have been working very closely with Hong Kong's medical staff throughout my public service career in my capacity as Assistant Director in the Health Department, as a member of the Hospital Authority Board, as a Director of Social Welfare. I have very high regard of the medical staff, medical nursing and allied health, and also supporting staff in the public system, whether in the Department of Health or the Hospital Authority. I have no doubt that they have the best interests of Hong Kong people, as well as Hong Kong, in terms of our healthcare system, which is highly credible, professional, as well as Hong Kong's overall interest. So the government has already taken a series of measures, and they are effective measures, as I have proven to you with some of the passenger statistics, to significantly bring down the number of arrivals of visitors from mainland and other places, so as to reduce the chance of infection and also to lessen the workload on the public hospitals. I have also pledged and have been working with the Secretary for Food and Health and the Hospital Authority to provide whatever assistance our health staff need, whether in terms of financial resources, in terms of supplies. I've been putting them on the first priority of the access to a very limited supply of protective equipment as well as masks, despite there has been aspirations for us to share some of this limited supply with the community. So I hope very much that they will also take into account these efforts made and seriously consider the plan. I really don't think a complete closure of the border control points is the right answer to the situation that we are facing. it is at least not in line with the very scientific-based and knowledge-based advice given to us as recently as early this morning by the World Health Organization and its panel of experts. We should not contemplate sort of restrictions of international travel or trade, and we should not adopt a discriminatory approach in dealing with people flowing between different countries and places in trying to contain the spread of the disease. There are other measures which will help us to achieve that effect. Director of Health?
Yes. Under the Prevention and Control of Disease Ordinance, this new novel coronavirus infection is one of the notifiable diseases. So when the doctor suspects a person who fulfills the criteria of referring to us, the patient will be sent to a public hospital for investigation and under isolation. And under the law, we will place an isolation order on this infected person. When the case is confirmed, we will conduct epidemiological investigation and identify the patient's close contact. And for the close contact, we will impose a quarantine order and direct the close contact to be kept in the quarantine center. So under either the isolation order or the quarantine order, this person is obliged to be kept in the place where he or she is directed to stay. And if he breaches it, it constitutes an offense.
Mr. Yao?
Okay, yeah. On the question of protective material, including masks, the government has been trying to help in a number of ways. We are taking a three-pronged approach. In recognition of the shortage, which is not just local but global, we try to cast the net wider. That government as a major user to procure such material for our frontline medical staff, we have been casting the net to a global basis, hoping that we can sort of secure a more long-term and also a greater quantity of masks. This we have been doing. In addition, we are also sort of working together with the retail and wholesale sector, who are also in great demand for such materials. We have talked to them and identified that, there might be certain sort of problems encountered in custom clearance when some of this material coming over from the mainland. So we have an established channel to talk to mainland authority, between custom authorities, to make sure that, certain orders which has been placed are able to be delivered on time and in full. So through this process, we have been helping both government departments procurement as well as procurement from the private sector. The third element is in recognition of this strong demand. There are also companies approaching us to see if we can help them in bring back production lines. So this area, we are lining up government departments to work together. In addition to all these, there are also sort of people and company who would like to donate certain masks for those in need, and we help them to channel these to sort of charity groups or people in need. Now, these are what we have been doing in the past couple of weeks. You mentioned about price control. I think we'll leave no stone unturned, as the Chief Secretary mentioned yesterday. But I think in considering whichever ways to tackle the problem, we must find a way which is effective in ensuring supply. Price control, if that is done as a malpractice, stocking up whatever, this is a job for Consumer Council, which has given advice, and also Custom has been taking enforcement action in the last few days, enforcing the trade description ordinance. So these malpractices are being brought before the law. But I think what we need to do at the moment is, in fact, try to enhance the global supply, try to make sure that, order we have placed will have sort of a prompt delivery, and also sort of ensure that, there was a good distribution system. In this regard, we are talking to both the trade and also within the department. At the same time, I think, we are also sort of encourage community to find various ways of sharing, like the gift that we have received and channel to those in need. Thank you.
One more English question before we come back to the Chinese. English question? maybe that side, sorry. The one at the vine, thank you.
Hi, I'm Marianne Benitez from Hong Kong Standard newspaper. I got 3 questions. First for Mrs. Lam. Okay, you said that we shouldn't be discriminating against certain types of people, right, the mainlanders. But the Labor Department yesterday issued a statement that FDH, foreign domestic workers, should he request them to stay at home, even on their days off. And the foreign domestic workers feel that this is discriminatory because they have only 1 day off where they could, do so many things and gather, but in open air areas, as you know. They've done that during SARS, where I think just 2 Filipino or Indonesians were infected by SARS because they went to a grocery store, at the early stage of the outbreak. That's one. Number 2 is, can you explain more about the electronic tracking device and GPS that I think it was Professor Chan who said that you're planning to do to track those people who are confirmed or suspected should be brought into the quarantine because they came from Hubei province, right, if I get it right. Number 3 is, do we know much more about the coronavirus? Maybe Professor Chan or Dr. Chan, Constance Chan, can tell us. Because you said, breaking news now that there are 2 confirmed cases in the UK. So it's spreading, right, globally. And Hong Kong and Macau is lumped in China, among the figures in China, because you're SAR. So what I'd like to ask you is, do we know much? There are so many unknowns. How is it a full range of, symptoms? Is it mild? Are you contagious when you don't have symptoms, or when you develop fever, or some other symptoms? So I just want to ask. And
thank you.
Yeah.
Please.
Okay.
Thank you very much.
Well, I'll answer the first question and then leave Professor Chen and Dr. Chen to address the latter 2 questions. Well, first of all, let me just quote for you what is in the World Health Organization statement. It makes it very clear that countries and governments are cautioned against actions that promote stigma or discrimination in line with the principles of Article 3 of the International Health Regulations. So this approach that we should not stigmatize or discriminate is well enshrined in an international health regulation, which means that it has very good basis from the protection of public health perspective and also the balancing, taking into account other considerations. Now, as far as, I just heard what you told me about the Labor Department advice. I have not seen it myself, but I suppose that advice was given really to protect our foreign domestic helpers by suggesting that they should stay at home. That was part of a strategy to reduce as much as possible this social context, or what we call social distancing. That also takes into account now currently the limited supply of face masks, because if they all go out and they enjoy their day, as we have seen from time to time on Sundays in various parts of Hong Kong, they are no doubt in a crowd, which means that they will have to wear masks and protect themselves attending those events. In the same way that the government has canceled, and many associations have also canceled events of a particular scale, whether it's outdoor event or indoor event. I think the Labor Department's advice is based on that very same consideration. The electronic device for home quarantine.
Okay, thank you. Thank you for your question. Actually, one of the active surveillance and also contact tracing, as well as isolating the contacts, these close contacts, is there are a number of ways to do it. Of course, putting people into quarantine camp is one. And another way is to do home quarantine. That is, people are staying at their home for 14 days. But of course, the idea of quarantine is for people to isolate themselves, at home and not to come out in a community, so that the risk of transmission in a community would be reduced. And way back, many years ago, for example, during SARS, perhaps there are people who are guarding at the entrance of the building or outside home to make sure people are not going out. But now, I think after so many years, there are lots of technology that can help to do this work in terms of tracing the contacts and where they are to ensure that they are staying at home and not going out into the community. So the development of these technology in terms of providing to these contacts is really to ensure that they can stay at home so that the entire quarantine procedures can be more efficient and probably to save some of the manpower for checking whether these people are at home. So as for your question on the 2 confirmed cases, I would like to invite the Director of Health, Dr. Constance Chen, to provide more information.
Dr. Chen?
I do not have the details of the 2 confirmed cases that were reported in the United Kingdom. Nonetheless, referring to your question on the nature of the coronavirus, indeed, this is a novel coronavirus, and it has only been identified in the recent few weeks. So you will note in the statement by the World Health Organization regarding declaring this disease as public health emergency of international concern. It specifically suggested that one should collaborate with WHO and partners to conduct investigation to understand the epidemiology and evaluate the measures. And it also encouraged the sharing of data on human cases, and it also suggests supporting research. So that is why I think the mainland scientist is working very hard, and they have also shared a lot of information with the international community, and they will continue to do research in this regard. And a number of the experts in Hong Kong are actually contributing to research in this area.
Well, in case media friends have more interest on the electronic devices that we have developed for the home quarantine, I'm happy to ask my colleagues in the Innovation and Technology Bureau, together with their partners, to give a briefing next week.
How are we going?
The last 2 questions. Good afternoon, Mrs. Lam. I am from the HKEJ. About the closure of borders, can you be clear whether you will not close the border control points under any situation, or would it be considered if there are a number of cases of infection or even fatality? And what is the advice given by the experts? Now the medical staffs are requesting a full closure of borders, otherwise they threaten to put on a strike. How would you respond to them? Just now you mentioned that, is it the case that you will not think independently given local consideration? You will just adhere to WHO suggestion? And what did you mean by special circumstances? Under these special circumstances, if you refuse high-risk travelers to enter Hong Kong, does that constitute discrimination? Is it already discrimination by cancelling the IVS permits? About mask supplies, it seems that the citizens is not buying into your allegations that there are enough supplies. Will you consider adopting a measures that only Hong Kong citizens with an identity card number can buy surgical masks? Because Hong Kong citizens has to go out every day. If they do not have surgical masks and they cannot go out, will you do more for them? For the first question, I would invite Mr. Yao to tell you more about the commodity. Of course, we are more concerned about the commodity for preventing the disease, that is mask, and about under what circumstances will we consider a full closure of our border control point. That means all the control points are linking Hong Kong to Macau, mainland, and other places. A full closure means no entry and no exit. That is impractical. But that's what you said. You said a full closure of all border control points.
Can you please let me finish? I was quoting what she said. She did say close all borders. Please be quiet. Please let the Chief Executive answer the question. No, we talk about full border closure. That does not mean that people are not allowed to come in and out of Hong Kong. No. But maybe you have special measures. Maybe we're just talking about people with a Hong Kong identity card. They may be free to go in and out. We just want to limit mainland people from coming to Hong Kong through various types of visa, because now they could still use a business visa or visa to visit relatives, and they can come to Hong Kong. And there are people still holding visas. The visas have not expired, and they could still come to Hong Kong. So I'm talking about this group of people. Thank you. Well, yesterday, I already said earlier that yesterday we have taken measures to control boundary points. So we will keep reviewing the situation, and we will consider other measures, and we will consider this together with the mainland authorities. So we will be doing that. But then if we get to a stage that no one can go into Hong Kong, it doesn't matter who they are, then definitely that is in conflict with the guidelines of the WHO, and that those guidelines are laid down in accordance with the international health regulations. That is, that we must not take any measures that may encourage discrimination. Now here we're talking about a public health issue. So maybe people ask, how come we are defining groups by their place of domicile or by their nationality or whatever? Well, as I said earlier, we would do our utmost to reduce the size of people flow between the mainland and Hong Kong, because every time when people cross border, especially coming from places of outbreak, there will be risk. They will bring with them risk. That includes Hong Kong residents, which is all about the control of people movement. And we've taken various measures, and we've seen some results. And but then I believe that the number of arrivals will continue to go down in the next few days. Now, you mentioned that earlier on we took measures to, say, suspend individual visitor scheme, or we target Hubei province, and for people who've stayed there within the past 14 days, there will be more stringent control measures for them to come to Hong Kong. Well, this is a matter of proportionality. Whatever we do, it has to be proportionate. We've explained that when we announced the measure for Hubei and Wuhan, that's the epicenter of the outbreak in terms of the number of cases and in terms of transmission. So that's why we've taken this step. In fact, so far, not many places around the world have adopted this measure. Now, there are 12 confirmed cases, 7 from the mainland, 5 are Hong Kong residents. But in other places, they may have more than 12 confirmed cases, and 100% of those cases involved Chinese nationals. Even so, these places did not adopt any limiting measures that target mainland people, because for everyone, the focus is on public health. And if there are any health risks, we adopt a measure that will ensure early detection, isolation, and treatment. And as it's the same. There are 2 Hong Kong residents who are in Guangzhou. They are confirmed cases, and now they're receiving isolation and treatment in Guangzhou. So that is the measure proposed by the WHO. They want all places and countries to adopt these measures in preventing and controlling the disease. Well, actually, I mentioned it at the press conference yesterday. Now, the public, of course, require different types of protection, and we cannot just rely on the mask alone. Healthcare experts have told you all the steps to take for prevention. And it's true there is now a problem with supply, because the main manufacturers on the mainland. Of course, the mainland has a strong demand for masks as well. At the same time, we need to make sure that when people buy masks in Hong Kong, or whether it's a government procurement or private sector procurement, well, when people procure masks, they bring them to Hong Kong. So what we need to make sure is that the orders they've placed will be delivered. And then we need to look at the actual demand. Of course, during this period, there will be increased demand or usage of masks by healthcare staff, and some may feel assured only if they have masks at hand, and probably all Hong Kong people have this demand for masks. For the government itself, it does not keep a large inventory, so we don't have enough inventory to distribute masks. But then we know in Hong Kong there is an extensive retail network. Usually, they will be more effective in distributing masks than the government. That's why our focus is now on ensuring supply. And we've been in discussion with the retail sector, and if they do get the supply, how we could better distribute them. Can you answer a few more questions, please? Last question from Apple Daily. Perhaps I will ask more questions on behalf of the colleagues. First, Italy has just announced prohibiting Hong Kong flights from landing in Italy. So is that discrimination? So must we follow strictly the WHO regulation? If we don't, then is that discrimination? Now, Mrs. Lam, you never wanted full border closure, but from surveys, we know 80% of Hong Kong people support border closure, so we could stop mainland people from coming to Hong Kong. You compare figures for a 14-day period, but between the 30th and the 31st, there's a drop of only 29.6%. So how we explain just the figure for just a day? And then at Princess Margaret Hospital, there's a 75-year-old cancer patient. The patient was there for 6 days in a general ward, so there's a 6-day period. Was there? So is it true that the health declaration was effective? So you can make sure that mainlanders will tell you honestly where they've been and they're not hiding anything. Second question: we can't buy risks. Many masks in Singapore, each family will get 4 masks. In Hong Kong, a box of masks now costs $900. And then Sylvia Chen said a few days ago that on the 21st that there was still the price was still right. So would you apologize to the public on behalf of her? And third question is that there are police officers wearing PPE. Now, the Customs Excise Department manufactures 1.1 million masks every month. Where's it gone? Now, the police, they have all the supplies. They have seized all these masks. Where they're using them? Will they return them to the public? And would you consider a new arrangement like Singapore? That is, if there are elderly members in a household, they will get so many masks and so on. So I'm asking all these questions. I've got 3 questions. I've recorded 4 more questions, but anyway, I will take them one by one. First, you said that Italy stopped certain flights. You used that as an example. Actually, we did that earlier than Italy. It's because we want to reduce the traffic movements between the 2 places for the purpose of reducing the flow of people between the 2 places. Well, we took some measures earlier, but starting from yesterday, we have put in place really stringent measures for flights going from Hong Kong to various mainland cities. The numbers been slashed by half with the support and cooperation of the airliners and the relevant authorities. So we are taking these measures to reduce. We've also suspended certain boundary control points because then we'll make it more inconvenient, and hopefully then we could reduce the flow of people. And I believe that is what the WHO could accept. But of course, here we're not talking about that. And secondly, during a certain period, we have seen a drop in the number of arrivals and departures. Even if the government does not take any measure to control points, people will not be traveling so much. And then we see that we have the support of the central authorities. There will no longer be new individual visit visas, and then group tour visas have been suspended as well, so we will see a continuous drop in the number of arrivals. Just now, the reporter from the Hong Kong Economic Journal mentioned that there are still certain valid visas in the hands of some. So we will work with the Guangdong authorities to see how we could monitor that, because the country has made an appeal. Now, for people who hold valid endorsements of visas, they should not travel out of the country. This is the appeal of the country. And if their visa has expired, they could get a renewal for free in future. So therefore, with that, we'll be better able to control the flow of people. Now, as for the case yesterday, I don't think that's a mainland resident, 75-year-old. That's a Hong Kong resident. So that's why sometimes you really have to stay objective. You mentioned that 75-year-old, a confirmed case. Well, that's actually a local resident. In fact, out of the 12 confirmed cases, 5 are local residents. Now, because there is a panic among the public, they do not know what supply situation will be like for masks, or just because they can't buy masks now, they panic, and so when they know that any retailer has masks for sale, they queue up early. Well, yes, this is something we must pay much attention to. That's why we keep working on that. We hope to be able to increase the overall supply of masks in the market and in the community. Now, Mr. Yao has talked to the Retail Management Association. If masks are available but they're not available in large number, then retailers must really consider how they would publicize or promote the sales of this mask, since the number is limited, and then they could prevent the situation mentioned. As for the production by the Customs and Excise Department, they are now able to produce about 50,000 masks per day. So instead of 2 shifts, maybe there could be 3 shifts in a day, and then they may be able to produce about 70,000 masks a day. Now, these masks are for government use. Not the Customs or Correctional Services industry. Usually, such products will not be launched in the market, so there won't be competition with the market. Now, as for 1 million masks or so for government departments and other public organizations, well, that number is not at all sufficient. Now, this mask we're wearing in this color are all produced by the CSI. As for masks produced by Correctional Service Department, there is certain identification. If someone tried to sell this mask in the market or online, we will certainly pursue them. So that's actually the hospital authority reported a case to the police. A certain staff member stole some such items. So it's not a question of which department will get the mask, but we'll go by the principles I mentioned. When they provide services to the public, and if they need to wear a mask for their own protection and for the protection of the public, then such masks will be distributed to these departments for use. Now, really, I hope you won't target a particular department when it comes to masks. That's the end of the press conference. Thank you.